Good day, my new friends. My name is Beckie Bilcowski, and I have MCAS. I am honored to be included in this year's ILC Foundation conference. I'd like to thank Dr. McEwen for not only this opportunity to speak with you today, but for giving me the tools and much-needed diagnosis that I believe saved my life. My health journey started 3 years ago, the week before my wedding and just prior to the pandemic. I have been fortunate to have been treated and examined by some of the smartest minds in medicine, but until I met Dr. McEwen, they were all at a loss, medically speaking, on what was actually wrong with me. The very first doctor that assessed me stated I was a 40-year-old woman that worked too much, that I needed to go home and elevate my legs and get some compression stockings. You see, I'm a PSW and I have been for 20 years. I worked on the enhanced monitoring unit at a long-term care facility. The years prior to my health decline, I had minimal days off and at times working 33 days in a row. Healthcare is a demanding profession. Most of my coworkers work the same level of hours, and this was prior to the pandemic. Everyone has their own COVID story with strife and hardship, and mine was not the exception. The pandemic delayed appointments and testing. I am a firm believer everything happens for a reason and works out the way that it's meant to. If I hadn't had multiple delays, I might not have crossed paths with Dr. McEwen when I did, and potentially still have an unknown diagnosis. I initially spent 2 weeks in hospital meeting with many doctors from multiple fields, testing everything from a spinal tap, CT, MRI, ultrasound, and blood work. I was discharged without answers as to what was wrong with me, and more questions. Visually, my legs appeared to be dying. I was mottled to my waist at this time. My experience as a PSW working with palliative patients, the only time that happens is when the end is near. I didn't feel like I was dying, but my legs looked like they disagreed. I spent the night before my wedding making final arrangements and writing letters to people that mattered. I would spend another week in hospital before I was discharged, alive, and in the same condition I was admitted. My husband made arrangements for me to go to a clinic in Toronto accompanied by my aunt. The clinic was well known, and I met with another team of doctors that were confident they could help. I left after another week with follow-up tests that had originally been missed while I was in hospital, but still no answers. My legs were constantly sore and felt like muscle or nerve spasms that went up my legs every time I tried to walk. Edema was my enemy, specifically in my legs. At times my legs would go numb and would give out, and I would fall. I was scared and grasping for any explanation. While I was waiting to cross paths with Dr. McEwen, it was a long, painful, and if I'm being honest with myself, a full-blown depressing 2 years. I had met with approximately 12 healthcare professionals and stumped all of them. The closest I came to a possible diagnosis was a neurologist that suggested I had 2 things wrong with me in tandem: a rare autoimmune disease that she hadn't heard of, and a neurological disorder she hadn't seen before. She decided to try IVIG on me. I was adamant that I not take a nerve blocker medication, which seemed to be the obvious choice. I didn't want to take one until I knew why. I am not against medication and would willingly take one once I had a diagnosis, but not before. I also declined many pain relief options for the same reasons. Treating my pain was only an option when I could understand why I was in pain at all. After 6 months of IVIG treatments, I had little improvement with my legs mobility-wise. However, the modeling that was present on my legs did lighten several shades, from black-purple to a brownish red. Due to the ever-growing pandemic, I felt isolated, frustrated, and hopeless. I decided to get a job as a greeter at Walmart using my wheelchair for mobility. Getting a job and feeling useful in my capacity kept my sanity and gave me something to focus on. Walmart made multiple accommodations to assist me in my goal of re-entering the work field in a different capacity. Walmart also provided insurance benefits, which I would eventually depend on in the near future with the ever-growing cost of the new medication plan. Here comes the depression. I got trapped in the negative cycle. I used to work 88-hour work weeks, pulling doubles and working OT. And now getting through 4 hours in a wheelchair brought me to my max intolerance of pain. It took all the strength I had in me to finish my shift 2 days a week. Instead of focusing on everything I was still capable of doing, I got lost in the daily cycle of pain in my legs and all of the unknown. I felt trapped inside my own body. It began to take a toll on my mental health, and my personal relationships suffered the consequences. It took several months of intense therapy with a psychologist before I felt I was mentally strong enough to go to the chronic pain clinic. Now I know what you must be thinking. Beckie, why do you need to be mentally strong before you would address your physical condition? The thought of seeing another doctor with more tests to come up empty-handed was just not something I could mentally digest. I was at my limit, and I knew I couldn't take another disappointment. I completed the 6-week chronic pain management program and met with the team. I had a connection with Dr. McEwen immediately. She was the first doctor that didn't suggest an opioid or nerve blocker after listening to my symptoms. We seemed to talk forever about my health history, some things that in my mind didn't even seem relevant at the time. She wanted the entire picture that had brought me to her office. For the first time in 2 years, I felt hope that I would walk again, and there might be an end to my pain. Dr. McEwen had a plan. She was honest and said it would take some time to confirm what she thought was wrong with me. There were some tests and some medications to start on and slowly build up to dosage-wise. If I'm being honest, I was ready to hang upside down from a tall building with no net if she said it would help. I was surprised at what was prescribed, and after a few weeks of taking the medications and vitamins, I noticed a change in my energy. It had increased, and pain levels had decreased. I did experience some side effects of nausea and vomiting frequently. Those days were awful, but I was determined to stick with treatment. I noted each increase, the nausea lasted about a week and then stopped. My husband and daughter both noted that I had more energy and was back to doing little tasks around the house again. They also noted I was much more pleasant to be around. Understanding how my disease was affecting them was a huge eye-opener. Pain does a lot of things to people, and in my case, it made me cranky and hard to be around. Each time I met with Dr. McEwen, I had some improvement of some kind to report, and I began to live a better life. When this all began, I needed to use a walker to get around at home. Each step was followed by pain, and I could only stand for almost a minute before I was forced to sit or risk another fall. There were days I couldn't get myself out of bed, and my husband had to lift me and care for me. I had several falls, and getting to the washroom was a huge task. I required home care daily, and I had to use a commode in the bedroom. Some days my pain was so bad, getting dressed was just too much effort. Doing simple tasks for myself wiped out my energy and increased my pain in my legs. Bathing alone wasn't an option anymore, as it wasn't safe when my legs would give out. I would have periods of incontinence when my legs would spasm and my pain was high. I was continually battling pressure sores, and sleeping was a daily nightmare. I had lost something I took for granted: my independence. I was given my diagnosis last year by Dr. McEwen and have slowly and steadily improved. although at times I still feel frustrated with my body. I was gaining mobility, however not fast enough for my liking. So this summer, I went a bit extreme with my physio regime, and I sent myself to the bush. This isn't something I'd recommend. However, it is how I chose to push myself. My husband and I love tenting, being in nature, and previously would set up anywhere for a weekend. So that's what I did. But I did it alone. I spent 2 months camping as much as I could. Usually my only companion was my dog, Sadie. My rationale was simple. Waiting for my body to come back to life was a very slow process, and I wanted to speed things up. I set out to make myself do this with zero excuses. When you are alone, you are forced to do for yourself. It was hard. I cried. I fell. I wiped my own tears and picked myself up. Repeat. I utilized my walker and my walking sticks, and I only came back to town when I had to work or an appointment. I had the full support of my husband and daughter, and I was on a mission to help myself. My physio improved leaps and bounds, and mentally, I was in the best mindset since this whole ordeal began. In July, I climbed Mount McKay with my husband's help. This used to be our annual first hike, and this would have been the 3rd year we didn't go. I used my walker in combination with walking sticks, as well as knee pads and shin pads for the parts that were too difficult, and forced me to crawl up the mountain. And trust me, I crawled. I also had a little stool to sit on when I had to sit and rest. I needed to get to the top of my mountain for a lot of reasons, mentally and physically. And I did. I had done what I set out to do. Recently, I started taking the next step in the medication plan with Dr. McEwen. I still have days where I'm exhausted and I have to rely on my wheelchair for longer periods when I'm required to stand, specifically for working. I use my walker for short distances. I no longer have home care, and the commode has made its way back to storage. I'm not completely back to my normal, but I am confident it's going to happen when it's meant to. Every day is a new day with possibilities and adventures. Some days my adventures include hiking, and other days they include making it to the bathroom on time. I stay in my positive rainbow bubble regardless, and try my best to be kind, no matter the level of pain or discomfort I might be in that day. I haven't had a single fall in over 2 months, and I'm gaining strength each day. I do wish this whole process was quicker. I'm not very good at the hurry up and wait. I choose to treat each day as a gift, even on the days I have to use my wheelchair, when I planned on using my walker. I remind myself the night before my wedding, writing those letters in a hospital bed, believing my time was almost up. I'd like to close with my most favorite quote by D.H. Lawrence. I never saw a wild thing sorry for itself. A small bird will drop frozen dead from a bough without ever having felt sorry for itself. I love this quote, and I forgot the part about not feeling sorry for myself a little while back. There aren't words to be able to explain or describe the feeling of self-pity accurately. At my darkest moment of hopelessness, fear of the unknown, frustration with my body, and the inability to do things when I wanted to without assistance completely broke me inside. I didn't understand why this was happening to me or my body, and after each session with any previous medical professional, I was more discouraged and depressed. I've always been a happy rainbow unicorn kind of girl, but this disease brought me to my knees, literally. Dr. McEwen gave me the tools to start clawing my way back to a new normal, life with MCAS. She can prescribe and suggest, but I have to be willing to do the rest. Each shift I'm able to complete at work is a success. Each hike that I complete is a success. Each step is a step towards taking back my independence. Thank you for allowing me to share my story.